You have a sprawling hospital, the biggest hospital in the state, that caters to almost, 3 in every 4 patients in a way, in a small state like Goa would perhaps use this hospital, and yet it did not have the kind of modern facilities that you need. Now there's a super speciality hospital which has been commissioned earlier, which is now taking some of the patients. But clearly a state like Goa was completely unprepared, it appears. What does it say about hospital management, Dr. Britto?
Rajdeep, thank you.
And political governance.
This should not be happening. This should not be happening. Goa is a small state. Not only do we have a population of 15 lakhs, we have a geographical area of just 3,700 square kilometers, but we are India's richest state by per capita GDP. This should not be happening. The story, of course, unfortunately, isn't new. It's not something that happened last week or last month. Look at the data. If you look at the positive cases per 100,000, the per capita new cases in Goa and the deaths per 100,000 have been the highest in the country, higher than even Delhi and Bombay. Coming to the specific point that you raise of oxygen, one of the aphorisms we are taught in medicine is when there's a crisis is to call for help. We should be shouting for help. We should be shouting to neighboring states, to the central government. We should be co-opting the army and the navy, which have significant presence here in Goa, to take over tonight, to take over the logistics of the supply of oxygen to private and public hospitals in Goa. But Rajdeep, oxygen is just one piece. It's not just oxygen. We will never have enough oxygen. Mm-hmm. We will never have enough hospital beds, ventilators, and the trained medical and clinical personnel. The only way, the little solace to those who have lost their loved ones, but the only way, Rajdeep, to stall this pandemic and prevent the next pandemic is vaccination. For every vaccine that's sitting on a shelf in Goa tonight, there's one person who has not received the vaccine, who in 2 to 3 weeks' time, when they do come across the infection, their chances are 70% improved. They're less likely to enter hospital by 70%. We should be vaccinating round the clock, 24/7. Just like hospitals work on shifts, we should be vaccinating round the clock, by shift. We have to stop mopping the floor and we have to turn off the tap, Rajdeep.
I take your point, because again, a small population where perhaps the vaccination drive should have been far more effective.